This week, Utah became the first state in the nation to ban fluoride from public drinking water.
The naturally occurring mineral has been artificially introduced to water systems for more than 60 years because of its beneficial effects on the teeth.
However, it is now facing increased scrutiny that seems to be gaining traction across the country and, of course, right here at home.
Nick Reagan has been investigating the process of how fluoride gets into the water, how much, and why the calls to remove it are now growing louder.
At the Charleston Water System plant in Hanahan, the day starts with natural water flowing into the system. Mike Saya and his team shows me how dirt, pollen, and other particles are removed before germs and bacteria can be killed off. Part of the process requires them to add chemicals.
There are a lot of additives that go into the water treatment process, and the important thing to know is most of them are food-grade chemical additives. You have alum that you'll find in your grocery store in the spice aisle. We add orthophosphate, which is another food-grade chemical, and that's what coats the inside of lead and copper pipes and keeps you safe if you have lead in your plumbing.
Also added, fluorosilicic acid.
We have fluorosilicic acid delivered to our water treatment plant a few times a month to keep up with our demand. And it goes through a series of pipes and a series of holding containers because we want to have very fine control because our dosage amounts are very, very exact.
The recommendation from federal and local health officials is that fluoride be added to the water at 0.7 parts per million. To put that into perspective, if you've got 4 5-gallon buckets of water, you would need to add 1 drop to get that concentration. But even this one small drop is being closely looked at.
I'm working with Lee Zeldin to reassess the fluoride rules based upon the August release by the National Toxicity Program of new science that shows a direct inverse correlation between exposure to fluoride and IQ loss, particularly in children.
A national conversation spearheaded by Health and Human Services Secretary Robert F. Kennedy Jr. about removing chemicals from our food and water supplies has given voice to people around the country demanding fluoride be removed from drinking water.
A federal judge has ruled that the risk that this could be the cause is too high, and it should be further studied. In our situation, we think, yeah, let's just take it out and encourage people to brush their teeth more.
That conversation is now being considered by lawmakers here at home with a bill in the House to ban water providers from adding the naturally occurring mineral.
The thing to remember here is it's a trade-off. What we've seen on the vast majority of these studies, whether inside or outside the United States, is, yeah, there is some kind of connection between fluoride. The question is how much is too much regarding brain health and brain development for kids. So I think at this point in United States history, or in our current circumstances, it's not worth the risk.
Community water fluoridation has been hailed by the CDC as one of the 10 greatest public health achievements in the 20th century, being credited with reducing tooth decay by 25%.
I hate to admit how many years I've been in dentistry, but over a period of the last 50 years, I've seen actually a dramatic decrease in the amount of tooth decay that we actually see.
Dentist Dr. Bill Sasser leads a nonprofit dental clinic catering to those who otherwise would not be able to afford dental care. He says he can tell which communities have fluoride in their water just by looking at their teeth.
The most dramatic changes, though, that I've seen have been in my international travels, where I've been to communities where the water does not have any fluoride in it versus areas that do. We also, at this particular clinic, see a lot of international patients, particularly in Latin America. We see it's a sad story of just endless numbers of patients that come to us with teeth that are really bad, many of which can't be fixed, particularly even with young people.
Recently, studies like this one published in the JAMA Medical Journal or the August report from the National Toxicology Program have loosely linked fluoride to lower IQs in children. There are, however, 2 major problems with these studies, according to the American Dental Association. The studies are not actually experiments and are just analyses of data taken from other studies around the world, most from China and India, none from the United States. The strongest results in that August study makes a moderately confident conclusion that there could be a link to lower IQ scores and fluoride when the concentration is more than double the recommended level. What both sides do agree on, however, is that more research is needed.
I think everyone should be critical of every study that's presented to them, period, whether it's from inside or outside the United States.
I don't think there's anything wrong with studies, but I think what we have to do is to look at them with sort of a critical eye. And that is, it's very easy sometimes for researchers to make some pretty outlandish claims based upon some very limited sort of research.
Who stands to lose the most if fluoride is taken out of public water?
The folks that are going to suffer the most are those individuals who really are already hurting from a standpoint of public health and economically and other things.
The bill to remove fluoride from water is still stuck in a legislative committee until next year, but if it gets approved, Charleston water system employees would simply flip the switch.
We're not doctors, dentists, or epidemiologists, so we look to these health experts to give us guidance. If regulators decided that fluoride wasn't ideal to be in the water in the medical community, and they all decided that, and that became the guidance, we would simply follow that guidance. It would save us about $500,000 a year.
Saya says it could take 3 to 5 days for the fluoride to fully dissipate from the water if they were to turn it off. However, if you want immediate results, your best bet is going to be bottled water. Most companies don't add fluoride to their product. For Live 5 Investigates, I'm Nick Reagan.